Nagaland.TV sok manu laga was. Aji Nagaland.TV kan District Hospital Dimapur de aigina ase. Yate aigina taka to Health City Hospital Guwahati kan ba organize kurigina in association with RBSK Nagaland kan takan aji free screening camp for Congenital Heart Disease 0 to 18 years kandi takan idu camp de organize kurigina ase. Aro ami anke kopor hunishi ki takan idu free screening camp to Joa kali Kohima de organize kura bichire aji Dimapur de aigina organize kurese. Aro yate specialist doctor kan to Guwahati idu Health City Hospital Guwahati wa aigina takan idu free screening to diase. To aibi idu camp laka opportunity sai so. To viewers ite amika nama jute RBSK laga coordinator ase to ivi NLTV itu game na upor de hoda uti kurisawa NLTV ki time te animshi bishi paise to like itu achi itu game abdingan organize kra to itu la upor de olop details ramya na viewers kan olop janai dibo.
Thank you so much NLTV awunian time tina ai upar karne like yati thaka manuan bar bishi khushi pai ase aro regarding this program itu inaka se ki government ba impanel kurina ase hospital kando to like previous year kandi bi Sicha hospital ido Imphal bra ase aro Sky hospital tai kan bi ahi thake kilole it's already impanel with the government of Nagaland and so ido heart screening do time to time screening thake free de free ase aro so far idia impanel kurina thaka do Guwahati ido health city itu ang loti impanel kurna ase so they are coming for the first time na so idarne do it's a very good turn up so far for 50 hole ase patients to aji screen role la do to kina jawo itu do later on we'll see na olive what's the thing about it about the RBSK is like we have 4 Ds itu defects at birth na or diseases inaga alak charta ase 4 Ds ko to tati bra tati heart laga aro especially free of cost like RBSK la scheme ekta ase program ekta ase idu RBSK ko do Rashtriya Bal Swasti Karyakram koi to itula program under de free coverage de like device surgery bi hoy kumba do open surgery bi hoi jai to idu kan do sob to impanel kurina thaka karne do aro along with that CMHS are idu ki ase idu kan bi use group right suppose like RBSK ba cover group arna equally do Ayushman card through idu ba fully coverage to dia nishina lagi ase kali idu do some few expenses tayo pare itu ase aro pagi laga do idu do sob free ba takan treatment de ase
to panchis ba idu pacha to tite khushi guli do aro apni next step to kina role ase
like ina usually do one at the same time udu patient kan do chabuli mon ase for example ina usually do mon yadi mon la MO tuita ase RBSK MO tuita ase to taijun bra refer gori dibo confirm cases kan ge do refer gori dibo idu referral card to tagan lui jaina hospital le tagan treatment avail group aro and then it will cover by the RBSK program
to idu amnian idu RBSK la under de khali free heart surgery la grina aro alak kan bi
alak bi ase like club food kan ase and then I would like to introduce tai ase Anushka Foundation to tai ra aro RBSK la under the coverage dia la do club food laga do tai aro ko
mohan Anushka Foundation la ase moi aro yate RBSK khan lote collaborate kurina kuri ase to thing beya khan etu han every Friday de orthopedic OPD de khan free treatment dia ase so apni khan enega club food la patient enega ase kole to ahi gina yate orthopedic OPD de apni khan kiba kuribo paribo thank you
सबके सलाम जनाय আছে আমি খান ইয়াতে নাগাল্যান্ডে জিমান আছে তাই খানকে সবকে সালাম দি আছে আৰু আমি খান তো ইয়াতে হেলথ সিটি হসপিটাল পৰা আহিছে আৰু ইয়াতে ডিমাপুৰ ইন এসোসিয়েশন কৰিছে RBSK পৰা এছ'চিয়েশ্যনৰ পৰা আৰু আমি খান হস্পিটেলতে সব খান লগা ফেচিলিটি আছে যেনেকা লাইক হাৰ্ট ট্ৰান্সপ্লেণ্ট কৰিবলৈ কেঞ্চাৰ আৰু নতুন নতুন মেচিন আহিছে কিডনি ট্ৰান্সপ্লেণ্ট নিউৰলজিকেল গেষ্ট্ৰ আৰু যিমান আছে সব আপুনি খান বাচ্চা লগা পেটিড্ৰিক এইটো খান সব পাবলৈ আছে আৰু আমি খান তাতে লগা হস্পিটেলটো আপুনি খান কাৰণে আমি খান নাগালেণ্ড কাৰণে 10% ডিছকাউণ্ট বি পাব আৰু তাইতো মই লগা নাম পৰা যদি যায় মইতো এভৰিবডি ন'জ মই লগা নামটো আমুংলা আছে হ'লে বি গুৱাহাটীটো আও বাইদেউ এনেকৈ মাতে আও বাইদেউ লগা নাম পৰাটো হ'লে 10% ডিছকাউণ্ট পাব আৰু আপুনি খান চব বি আমি খানকে মদত কৰিবি আপুনি খান লগা ৱেলকাম আপুনি খান লগা ভাল পৰা কথা খান ভাল পৰা এছ'চিয়েট কৰি দিব মই পৰা কিবা দৰকাৰ হৈছে ক'লে আপুনি খান পাব আমি খান লগতে ফ্লাইট পাব কিবা বিমাৰ মানুহ লৈ যাব কাৰণে এম্বুলেন্স পাব এম্বুলেন্স বি লৈ যাইছে ক'লে ইয়াতে পৰা লৈ যাইছে ক'লে বেমাৰ মানুহ আমি খান ভাল ভাল এম্বুলেন্স আছে আৰু আমি খান লগতে টেকনিচিয়ান খান আৰু সব যাতে মনিটৰ ফিটিং থকা খান তাতে সব আমি খান পাব আৰু আমি খান তাতে পৰা ইয়াতে আহিছে ক'লে 40,000 মাঙে হ'লেবি আমি 30,000 পৰা দিব কেলে মানে নাগা মানুহ কাৰণে নাগালেণ্ডে কি জাতি হ'লেবি আমি খান 10% ডিছকাউণ্ট কৰিব আৰু আপুনি খান এনেকা সব আমি খান লগতে এছ'চিয়েট কৰি থাকিবি তাৰ কাৰণে বেছি খুচি হৈছে আমি খানকে ইমান ভাল পৰা হেল্থ চিটিৰ পৰা ৱেলকাম ভাল কৰাৰ কাৰণে ইয়াতে ডিমাপুৰতে যিমান চিভিল হস্পিটেল পৰা যিমান ডক্টৰছ আহিছে যিমান ষ্টাফ হৈছে সবকে থেংকছ দি আছে থ্যাংক ইউ
তো ভিউৱাৰ্ছ এতিয়া আমি খান মাজতে ডক্টৰছ খান বি আছে তাইবি তাহান নদিবি ইটো কেম না ওপৰতে নদিবি তাহান ইটো কি মাকসাদ প্ৰায় না অৰ্গেনাইজ কৰিছে ইটো উদাউটি কৰি কিনা আমি এনেকৈ জানাই দিব thank you both of you for giving time to NLTV so both of you like can you please introduce yourself to our viewers
Yes. Hello viewers, I'm Dr. Saurabhi Das. I'm actually the child cardiologist. So I am into diagnosing all the heart diseases in children by doing echo and also by doing the clinical examination.
Hello, I am Dr. Naeem Raja. I am the pediatric heart surgeon and I operate on babies and children who are born with heart defects. I do open heart surgeries for those babies who are born with heart defects. Thank you.
So what kind of medical facilities and service will you be providing in this screening game
Yes. So through this camp here, first of all, we are going to identify all those children who are suffering with some form of heart disease or are suspected to have some form of heart disease. So once we identify those children, we are first going to give them some medications which are going to stabilize these children, follow them up, and if needed, we are going to call them for operations. And the operations that we are doing are both open heart surgery as well as there are some which are known as the keyhole surgery, where we do not open up, we do the surgery through the veins of the children through their legs. So this is what we are going to do. Yeah.
so like what are the common signs and symptoms of CHD
See, the common signs and symptoms of congenital heart defects, mostly the children who are born with heart defects depends on the type of the disease. If certain diseases, they present very early, even in the newborn period. So sometimes the most common symptoms are like the fast breathing is there. Sometimes there is bluish discoloration of the skin, lips, tongue, nail beds. And then there will be the most common thing. Another one is that the babies or children will fail to gain weight properly. The normal rate at which the child should grow does not happen. So those are the very, very common symptoms which we should identify. Plus, if the child is having recurrent infections, like in the infections in the lung, cough and cold is there for which needs hospital admission, then we have to definitely rule out heart diseases.
and then at what age does CHD usually detected and how important is early screening
Okay. The CHD can be detected at any age. We can actually diagnose CHDs now inside the womb of the mother. Like when the mother is pregnant, there is a test which is known as the fetal echo, which I do as a pediatric cardiologist. So if the parents come to us, we can see the heart of the baby inside the mother's womb and diagnose very critical illnesses as well as simple ones by doing that echo. Then again, after delivery, sometimes the baby doctor will see that the child is not maintaining the saturation. the oxygen level in the blood. So oxygen level falls. So then we can suspect and we can diagnose. Again, just after birth, after a few days, when the baby is given to the mother and going home for breastfeeding, the baby will not be able to feed well. There will be lot of respiratory distress, fast breathing, and then will not accept feeds well. So then we can suspect. Again, later on, when the child is going to the school or going for some vaccination, the baby doctor can hear into the heart of the child and then diagnose that the child is having some congenital heart disease. Sometimes they are fainting in the school. They are going and fainting. So that may be because of heart disease. And last but not the least, some congenital heart disease are present in older generation, older people like 50, 40 years. These many years they don't even know they were having heart disease, and suddenly one day they have some chest pain or they have some other operation like gallbladder and all, and then they are doing an echo and then they come to know that there is a hole in the heart. So we are giving treatment for all types of heart disease from inside the mother's stomach till old age. Everyone we can treat.
It's very difficult. I mean, if you are asking me about the risk factors or the causes, I mean, we definitely we do not know what are the definite causes. But yes, sometimes there is history of family. Like if there is a family history of a heart disease, then the siblings or the children might have also an increased chance to have heart diseases. Sometimes it's a very myth is there. We believe that the pregnant lady, when she gives birth to a baby with heart disease, she thinks that she must have done something wrong during the pregnancy which might have led to the heart defect. But honestly speaking, most of the things, the heart defects, we do not have any control on them. Sometimes it might be related to just the genetics, and sometimes it might be just related to certain environmental factors. So exact cause, we don't know, but certain risk factors like certain medications, if you are taking during the pregnancy period, those medications can lead to increased chances of having heart defects. Also, certain drugs and maybe alcohol consumptions, tobacco consumptions may also predispose the children to have heart defects.
So lastly, like, what advice would you like to give to the parents regarding their child heart's health?
Yes, regarding the child's heart health, the first thing I would like to say that they have to insist on eating healthy. That is the first thing. The second thing is, do not miss your immunization or vaccines. You know, in children, we have to give them the vaccines. Then do not miss small signs which previously you might have excused that this is happening in all children. Like suddenly when the child is crying, there is bluish discoloration around the lips or hands. You are thinking this is just simply because of crying. Don't do that. Please go to the baby doctor. Please tell them your problem. Share with them. Maybe they will do one echo, or they can send you to a cardiologist who will look into the heart, and maybe you will diagnose some complex disease also. The next thing is, please encourage sports. Activity like sports, outdoor playing. So this keeps the heart healthy. You can be swimming, or it can be badminton, cricket, football. This helps in keeping the heart healthy. The next thing is, please avoid fried items and do not make your babies obese. Like, you know, too much of fat in the body is not good for your child's health. So it will also affect the heart as such normally. And please, do not keep them in any polluted environment, near to the factories or where there is a lot of storm and dust coming. That also affects the heart health. So that is my advice.
I'd like to add to the beautiful advice that Dr. Sauravi has given is that if a child is diagnosed with heart defects, it's not the end of the world. Now I'm happy to say that most of the heart defects, almost 95% of the heart defects can be treated, and it can be treated completely. Yes, there are certain diseases which cannot be cured completely, but we can offer them treatment which will help them make their lives, the quality of lives better. So there are treatment for almost every heart defect that we can think of or that there is, and those children can have very good quality of life like normal children. They go to school, they play, they can also almost like 95 to 98% of those children with heart defects can also have such kind of life. So I'll urge the parents, if they find any kind of symptoms which can signify heart disease, so they should immediately consult a local pediatricians and maybe come to us because we are here in the Northeast to give such kind of treatment. The best part is that we don't have to go venture out of the part of Northeast India to get those treatments. Nowadays it's available, and we have been happy to say that we have been doing all sorts of heart defect treatments, both intervention and surgeries, and I hope those parents will be happy to know about it.
So viewers, amni amra huna ashina achi itu free screening camp de in case it any bacha 0 to 18 years tak itu takan itu congenital heart disease to detect hoshi gole to takan itu further treatment karni takan hospital to refer kuri kuna bi amian ke janai dishe aru ami khan ke janai dishe ge itu congenital heart disease laga minor symptoms kan do breathing problem aru itu bacha laga lips te bluish color shina olai guse aru itu kala noi kina breastfeed kradam devi bacha diktar pai kuina bi amian ke janai dishe aru itu bimar laga opor de doctors kan lote huta huti kram de takan bra amian ke janai dishe ge itu bimar detect holi laga iku specific age to nai kumba bacha kan do peti thakadam de bi detect hui jai aru kumba bacha kan do jonom hwa bishi devi detect hui kuna bi janai dishe aru itu kala noi na kumba do by genes pa bi itu bimar do bacha ki laki kuina bi amian ke janai dishe itu karni bacha kan laga heart to healthy ti rakhole karni doctors pa aman ke oily food na khawole aru bacha kan ke outdoor games kan sports kan khilule karni tahan bra encourage krise to the free screening game na opportunity details iman taki ase aru in the news aru update chani dekole sai dekbe NLTV moi si reporter moilongpom with my video journalist Kakivisu
Nagaland.TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.